Mrs. Jones, this is Jennifer calling from your doctor's office. I just wanted to remind you about your appointment tomorrow. And please don't forget to wear a mask when you come in. Also, I have a few questions I need to ask you.
These are the screening questions recommended by the CDC.
Work or live in a long-term care facility or other congregate living setting like a prison or shelter or group home? Or do you work in a place that has been identified as having a COVID-19 outbreak? Okay. Since you answered no to our questions, will you please sit on the left side of the waiting room, keep your masks on, and make sure to keep 6 feet away from other people? Hi. Your name is?
Mrs. Jones.
Welcome, Mrs. Jones. I have a few questions to ask you, and I need to take your temperature before you can go inside. Have you or someone you have had close contact with tested positive for COVID-19?
No.
In the last 48 hours, have you had any of the following symptoms? Fever, cough, shortness of breath, chills, muscle pain, new loss of taste or smell, vomiting, diarrhea, and or sore throat?
Yes. Fever and cough.
Okay. Are you a healthcare worker, first responder, work or live in a long-term care facility or other congregate living setting like a prison or shelter or group home, or do you work in a place that has been identified as having a COVID-19 outbreak?
No.
Thank you. I now need to take your temperature. Thank you. Since you have a fever and cough, can you please sit on the right side of the waiting room, keep your mask on, and make sure to stay 6 feet away from other people?
If space allows, delegate patients to a non-COVID symptom side or COVID symptom side of the waiting room. Separate toys into clean and used boxes so staff know which ones to disinfect. Place a line of tape on the ground 6 feet away from the receptionist's desk. It is recommended to have a see-through barrier between your receptionists and patients during interactions, like plexiglass. Ensure there is adequate hand sanitizer placed strategically around the room. It is recommended that you have patient rooms designated into non-COVID symptom complaints versus COVID symptoms.
Okay, Mrs. Jones, the doctor will be with you shortly.
Hi, Mrs. Jones. I understand that you're having a fever and a cough. I'd like to listen to your lungs if that's okay and see how you're doing, and then we'll go from there. I think for now we're going to order you a breathing treatment and hopefully we can get you feeling better. Is that okay with you? Okay. I'll have someone come in and we'll be with you shortly.
Please see the handout from CDC guidelines for aerosolizing treatments and proper PPE donning and doffing. any staff that enters the room during or immediately after must put on airborne contact precautions PPE. For example, when the patient is finished with the treatment and ready to go home.
So you're feeling better after your breathing treatment? So you're all ready to go now.
After patient leaves, if it has been more than 1 hour since the aerosolizing procedure, staff may go in and disinfect the room. If the patient leaves and it has not been an hour since the aerosolizing procedure, the room should remain closed and undisturbed until the hour is complete. Minimize re-entry into this room. Make sure to read all disinfection packaging to ensure proper use. If disinfecting a COVID symptom room that did not have an aerosolizing procedure, you do not need to wait 1 hour before cleaning the room. It is recommended to disinfect surfaces in between patient use.